first things first. Just so I'm a second year medical student. I'm not a licensed physician, so this isn't a substitute for seeing a doctor and getting legitimate medical advice from a physician. So just so we so nobody comes to sue me because I said something incorrect.
No, we won't sue you.
Yeah. So now that that's so Kelsey had sent me a few questions, and I'll just so she had asked what are. Oh, somebody's upset.
That's Lola.
She asked how a migraine works, and then how can the vestibular system be involved in migraines.
That's a great question.
So I guess we'll start by I'll just start by going through some of these, and if you guys have any questions or whatever, I can try to hopefully extrapolate a little bit and answer those. We'll see. We'll do what we can. So the first one, what are vestibular nerves? So vestibular nerves are primarily what's responsible for your sense of position and balance, and the way that your brain and your body responds to any sort of movement that you might consciously or unconsciously be undergoing. Given that they're nerves in our brain, in our skull, they're prone to damage from various sorts of mechanisms. So a lot of theories have kind of been thrown around about what might cause specific vestibular illnesses. One being that let me back up. Before we delve into this, one thing that I think is really important is that people kind of before accepting certain diagnoses, you need to have a workup by a doctor. And I know that Kelsey's told me about specific people that have kind of, and I say this not judgmentally because I understand where it comes from, but have kind of Googled their way to a diagnosis. And there's nothing wrong with being conscious of what's going on with your body, or being aware of what could be causing you to have the symptoms you're having. But the problem is that there can be very serious disease processes going on that can cause you to feel the way that you're feeling. And so if you haven't, and it sounds like, Patty, it sounds like you have at least, if you haven't, though, you haven't seen a doctor, like I would implore you to certainly go ahead and figure out a way to make that happen before kind of arriving at the place where you're like, okay, this is vestibular migraines, and we're going to just go from there, because there are a lot of very serious diseases that can cause vestibular symptoms that require immediate management. Otherwise, you're looking at a shortened life, unfortunately. So I said that to say, go see a doctor, talk to them, and make sure that life-threatening illnesses are removed from your list of potential diagnoses. So how does a migraine work? Basically, so this is kind of a topic of contention. So one of my professors is a pretty significant neuroscience researcher, and so him and I had kind of talked back and forth about this a little bit. And it's a very theoretical thing. There's not a lot of hard and fast research that I can point to and say, okay, this is A, B, and C are what causes migraines to occur. So there's a few different accepted theories that what might cause a migraine to kind of initiate, but the myriad of symptoms people experience after that initial onset, it just kind of varies depending on those different theoretical mechanisms. So first of all, everybody, on our brain, this is going to get a little bit lengthy. So Kelsey, stop me if I get a little too wordy. Okay, so I apologize. So everybody's brain has a few different layers of a really protective covering. It's called your dura. And so this this tissue has pain receptors in it. And so um, there are certain points that multiple pain receptors come together, and they're usually near these cranial nerves, like the vestibular nerve being one of them. But they're also near groups of blood vessels that exist in your skull. So the thought is that something somewhere causes these pain receptors to become really, really hyperactive and very, very sensitive, and nobody really knows why. Obviously, certain people have certain triggers to migraine episodes, whether it be like different foods or smells or lack of sleep is a big one. So it's difficult to answer that question just because it's everything's so theoretical and not much is known.
Can
I'll
I ask you something?
Sure, yeah, by all means.
You said that the dura, because there's nerves in it, and there's
Uh-huh.
nerves, of course, in our neck and all throughout our whole system, really. Um, if the migraine is supposedly in your brain, inside the brain,
Uh-huh.
when the pain receptor, whichever one it is, let's say, like my migraines start in my neck,
Hmm.
and then it goes into my head, but it's never like the classic migraine, nausea, lay in the dark for a week thing, blah blah blah. You know what I mean?
Yeah,
Um, it's just this pain, but the dizziness, the vertigo kicks in, and that lasts about 72 hours.
yeah.
So are those because maybe something's wrong with the neck going into
So
those nerves? Is that
no, that's a really good question. So the vestibular nerve actually, after it leaves the inner ear, it kind of travels back into the brainstem.
right?
And if if there's something that causes that nerve to become inflamed, or it causes any of the tracts associated with that nerve in the brainstem to become inflamed or irritated, it will cause you to have that severe neck pain. It can cause that pain in the shoulder. It can, so without having severe pain in your head.
Okay.
Then that would obviously then be coupled with all of the vestibular symptoms, the dizziness, and all of that as well. So yeah,
Oh,
that's not, yeah, that's perfectly reasonable that would happen.
oh,
Unfortunately,
okay.
yeah,
Yeah, because
yeah,
that's why I was wondering. That's why I asked, because I'm thinking, okay, if this thing is connected to the dura, the outside of the protective part of the brain, I guess we'll call it, um, and these nerves in your neck are being stimulated,
mhm,
and then they're stimulating the vestibular part of it,
right.
which causes the vertigo, then it would almost be safe to say, possibly, that it's somewhere in the neck, or maybe even the vessels or arteries of the neck. Is that
It's possible. So anytime that you have, especially when it comes to the brain and the brainstem, the bear with me here on this. So the brain itself, the actual tissue of the brain and the brainstem, they don't sense pain. The tissues and the structures that kind of cover and surround it, those do. So those do respond to inflammation and things. And a lot of times, what'll happen
oh,
is if those structures become inflamed, that pain and discomfort kind of, we call it referred pain. It kind of manifests elsewhere. If that
right.
makes
Yep.
if that does that make sense? Okay. All
Oh
right.
yeah.
Yes, that's probably what we're talking about here.
Okay.
But yeah. And so as we continue to have these like recurrent bouts of migraine symptoms, there's actually also, and this is a good thing in terms of, because Kelsey and I had talked at length about, there not being a lot of scientific interest in continuing migraine research because there's not a lot of money to be made and such, which is an unfortunate thing, because if you look at a lot of mental health research, you look at a lot of other disease research that goes on that isn't these kind of heavy hitting diseases like Parkinson's or cancer, or not that there's not that one disease is more important than another, but so some research has shown, though, that there are structural changes that occur in the brain itself, like in terms of MRI imaging people that have migraines frequently, their brains actually, and there's a pattern, but their brains actually look different over time after repeated episodes of migraine. So the hope is that these sorts of tangible, in quotes, findings will kind of help push push us towards doing more research and eventually finding some sort of definitive treatment, because unfortunately migraines are one of the top 5 causes of suicide in the United States, just because there's not there's, as everyone well knows, there's not a very sound, consistent way of treating them. So
Yeah, because that's what my ENT, the neuro ENT, I see when I talk to him about, because I kind of got like a little frustrated with him, which I'm sure he understood, but he knew by what I said that I was kind of a little pissy about it. I said, so basically when I'm on the slab, you'll be able to finally decide where this came from. And he just kind of looked at me and he said, no.
Oh.
I said, what do you mean no? And he goes, your brain will be dead at that point. There's no way for us to find it at that point. And I was like, what? And he said, no. He said, because the brain is so complicated and there's not enough research in it, with the migraine part of it. And he said everybody's brain, even though they look the same and most of them do the same things, they don't react the same. You know what I mean?
Right. And it's really tough, just because it's, so the way that the brain functions, it's all through neurotransmitters and hormones and that sort of thing. And so those things are very difficult to quantitatively measure. So just kind of as a, for instance, if somebody's having a heart attack, the method of imaging directly where that problem in their heart is easy. Well, I mean,
it is easy. I mean, yeah. My friend of ours just had one last week.
Yeah,
and it was very simple. Within an hour, they knew right where the clot was and had it fixed.
Right. So that's so something like that is super straightforward, whereas with neurological issues, unfortunately. So
yeah, neurological issues, like that's what he told me. He said neurological is so different. It's not just you have this nerve shooting here and it's causing this. He said, we can't see the nerves. We can't tell you where they're going. So I was like, okay, now I'm really, really frustrated,
Right, yeah, it's tough. I mean, I think if, gosh, I don't know. I mean, if there was any like bit of advice that I could give or could offer, I think being able, and if you had spoken to this earlier, Patty, but being able to really like control those kind of modifiable lifestyle factors that you can control, because obviously, you don't really, it's tough to know when you're going to have an onset of symptoms and be dizzy and have that pain that you have. But being able to do other things to manage, other pieces of your life, like trying to stay as physically active as you can, and eating as well as you can, and staying hydrated, and being on a good sleep regimen. I mean, those sorts of things, could potentially go a long way. And
the things that you really can control.
Right.
And the things that you find that actually do work.
Definitely.
You know what I mean?
Definitely.
Yeah. Okay, I'm getting a lot from this. I'm loving this. Hey, he's told me more than the doctor has, okay?
Yeah, and that's what I wanted to, point out too, is like, how you said, Bronson, at the beginning, like, even though you're not a licensed professional or, like an actual medical doctor, I mean, like, you were the main person who pushed me.
Yeah,
to
but we can he still has information. I mean, he's
Exactly.
studying in school. He, so yeah, he's got information, and he's willing to explain it where doctors are not.
Yeah, exactly. And like, and
Yeah,
that's important,
yeah.
So.
And I think too, it's important, I mean, the positive to support groups like this is that it allows everybody to kind of be in a relaxed environment where there's not like a pressure for time, and you're able to kind of talk about things, and people can casually talk about things with each other. You can talk about things in a more regimented way, kind of like we're doing now, I guess. I don't know. But the problem with going to your doctor's office and like, and I'm not making any excuses, but the problem with the whole healthcare system is that your doctor is expected to see like 30 people in an 8-hour day, and so a lot of them have a difficult time seeing each person as like an individual person, and so you'll have a
Right.
lot of doctors that kind of want to blast through their appointment and move on because they've got other things to do, which I will be the first to tell you I absolutely think is reprehensible, because it's gotten to a point where the healthcare system is starting to kind of dictate how doctors are taking care of their individual patients.
Right. That's
And
why I always try to get the last appointment of the day. That way I know I can stay for the whole 30 minutes. I'm serious.
yeah, and things like that are definitely not simple.
I'm horrible, but that's what I do.
No, I mean, you have to, like I told Kelsey before, I mean, you have to be your own advocate really when it comes to
Yeah.
managing your health.
Yeah.
So
Otherwise, you'll get nowhere.
right. Yeah, because
Yeah.
nobody's gonna do it for you, unfortunately.
No.
So
No.
right.
Yeah. So, what other questions did she have? This is really interesting.
That was, I mean, I think we summed through it pretty quickly, actually.
Well, another one that we talked about, and why I asked this is just to talk mainly, let me first say,
Yeah.
about anxiety and the physical manifestations that it can cause, and like our symptoms that are, our like life with chronic illness. But let me say that I'm getting brain fog. Cool. Don't know where I was going with that, but anxiety, physical manifestations, and how like I guess like how you differentiate, or basically like what you told me, Bronson, like things that you told me to differentiate, like this is anxiety or panic right now and to not fear, or this is an actual like vestibular attack, and basically like what would you go
That's
for
a good one.
Yeah.
I like that one.
Wait, different?
I like that one. Hi, Jeffrey.
Hey.
Yeah, I'm interested in that too, because my anxiety was really bad with this. So, and he always told me the vestibular center, let's call it, and the anxiety center, he said, are basically almost on top of each other. So he said, when you're having a vestibular attack, sometimes you will have, like I will have anxiety the day before the attack.
Yeah, me too.
And that's how I'll know, oh, great, something's coming on because I'm having anxiety for no reason. And I can tell the difference. Anxiety, it's like a weird, nervous, it's like a speedy anxiety. Let's put it that way. Yeah, like I'm on speed.
So that's really interesting, because it almost kind of sounds like, so people with classic migraines, they'll have an aura. So I don't know if any of you have classic migraines. I think Kelsey has, but I don't know if Patty or Jeffrey, if you guys do, where you'll
have 5.
Okay, so sometimes people will have like, they'll smell a smell, or they'll have some other sort of kind of random, seemingly unrelated symptom, and then that precedes the onset of a migraine. So it's interesting you say that, Patty, because it could be something like that, or it could be that you maybe were at a state of increased anxiety, which maybe triggered the vestibular symptoms to occur.
Right.
But I think it's important too to remember that, like Kelsey was saying, I mean, there's the extent to which anxiety can affect your body is absolutely it's absolutely insane. And the problem is that when we have when we have an issue with our anxiety being at a heightened level above normal, it kind of allows it can kind of allow our mind to play tricks on us. And so sometimes you'll have those classic anxiety attack symptoms where you'll have pain in your chest and you'll feel like you can't catch your breath, and maybe you're nauseated and dizzy, and you're sweating. And on one hand, those are all symptoms of having a heart attack. So that could be something really serious. But on the other hand, it could be that you're having an anxiety attack. So I think the one thing, and I'll go back to what I said earlier, the one thing that I think is really important before you try to differentiate between these things on your own is to go in and have a full medical screening, and be on a basis with your doctor where they're seeing you, and they're aware of what's going on with you, and they've kind of they've given you the once over to make sure that they're not concerned that you're at some high risk for some sort of serious life-threatening medical problem.
Right.
At that point, I mean, I think it's really tough to say, because I've seen personally both sides where somebody has brushed something off that was really serious and ended up with some really significant problematic outcomes down the road. So I think it's really it's kind of a fine line, I guess.
Yeah, because you have to know. I mean, like you said, because I know every time I'm in my doctor's office, there's a one of those little, how they have those posters all over the walls with your muscles and nerves and whatever. And, because I always look at them all. I'm like, yeah, okay, what's this? What's that? Blah, blah, blah. But there's always that little poster that says, oh, if you have headache, neck pain, shoulder pain, nausea, vomiting, dizziness. I'm like, okay, excuse you, bless you. If you have these or anything from your waist up to your head, could be a heart attack. I'm like, for God's sake, I may as well get a bed in there, okay?
Like the symptoms for anxiety, like vestibular migraine, like some traditional migraine, anxiety attacks, like heart attack and stroke, like all these things, like if you list the top 15 symptoms, it's all the same thing.
It's exactly right. Exactly right. So it's
had like 4 different things that we thought it was over time when I was trying to get diagnosed. And yeah, it was right. I mean, I went to, you say like make sure to have medical once over and check that everything's good. I think I saw at least 10 different specialties and several doctors in each, and like everything else was like perfectly spot on. There was like a few incidental findings in MRIs and things, but they're like, basically if you look this far, you're always going to find something because everyone's just genetically different.
Right. Well, yeah, and every specialist is gonna they're gonna approach a problem differently. So when you go see a neurologist, and they're gonna want to do an MRI and a lumbar puncture and all of this crap and put you on this drug. But then if you go and you see an ENT that's not a neuro-otologist, they're gonna have a completely different approach to everything. And so that's definitely one big pitfall of
right. So that's,
if you dig too deep, you'll find something. And so
right, because I talked to a doctor the other day on the phone who was is a customer of my husband's, and my husband brought up what was going on, and he said, oh, and his specialty was Lyme's disease.
Oh yeah.
Yeah, and he cures Lyme's disease, or he did. He's retired now.
So let me guess.
Huh?
I said, let me guess. He thinks you have Lyme then?
Yep.
Okay.
Yep.
That's the first thing that doctor tested me for.
I've never been tested. Never been tested. And he said, he said, yeah, you should get tested. He said, because even though we live in Florida, where every person on the planet says we don't have those type of ticks, he said he said we're finding that the dog ticks, which is what we have, the veterinarians are now getting Lyme's disease because of these dog ticks.
Oh my goodness.
And I was like, what? Because I had a dog that had ticks, and I had him in my house and had to have them removed from my house. So I'm like, oh my God, maybe I do have Lyme's disease. You know, I mean, he's like, are you ever short of breath? I'm like, yeah. Do you ever sweat? I said, yeah, I have hot flashes. And he goes, but those could be sweating. I'm like, oh no, just shoot me now. You know? And then I was like, okay, nope, I'm not playing this anxiety game. No.
That is, oh my gosh.
I guess
So, but yeah, I mean, the Lyme's disease, if you look it up, but the problem with Lyme's disease is he told me there's like 15 different types.
Oh God.
So you can't just, and I looked up, he gave me 3 that he said were potentials. He gave me the names and the spellings of the 3. So I looked them up, and one of them, I had like 5 of the 8 symptoms. And I was like, oh shit. You know, now what am I going to do? But then, of course, he gave me the name of a doctor to go see, and the isogenics testing to get, he said you should get that done, not the regular Western blot and all that good stuff, because that doesn't tell them which parasite that it is.
Right.
You know? So yeah, so that's another thing. It's like, and I said, well, you know, all the symptoms that you just named are symptoms of panic disorder. He goes, I know. And he goes, how do you know all this stuff? I'm like, I research a lot, okay? A lot. So, but how do you know? I mean, other than getting tested, you don't know.
I mean, they gave me antibiotics just as like like these are what would, you know, we would treat someone who has it. And like they gave me that regimen, and I was like, all right, whatever.
Yeah, so they do it anyway because,
Yeah.
I mean, anything you go to a specialist for, you're going to have their disease.
Right.
Because,
Yeah, that's exactly.
You know what I mean? You're going to have that disease because
especially when
that's
you're in the
their
whole realm
specialists.
of like diagnosis by exclusion. Like that's where you're going to run into it, because every doctor is like, well, you've excluded everything else except this.
Except my specialty. And you're like, oh, no.
I think the biggest thing that I've been trying to understand is like with traditional migraine, it comes generally like in attacks or something, or like individual events. Whereas this is 24 hours a day, like unrelenting, you know, like it'll get better or worse. And then sometimes I will have the individual like traditional aura migraine attacks and then back to this, but like that this is a 24-hour condition.
I think that's where we're all confused, is because we supposedly have these silent migraines, but how can you have a migraine for 3 straight years or 10 straight years or 12 straight? You know what I mean? But my ENT said it's not that you're having the constant headache or silent headache. He said what's happening is you're having the headache for the 1 day or 3 days, whatever your days are. And he said after that, then you're having the residual, and then you're having another attack. Does that make sense?
Oh,
that went for like a year without any sort of major attack. And I still had, you know, it's still the same level it is now. That's just why I don't understand it.
Yeah, that's where we're all confused, I think.
Yeah, I mean, that's a really tough question to kind of delve into, just because, you know, as you all well know, there's really not a body of evidence to stand on to say this is likely what's causing that, because because dizziness and vertigo, in and of itself is really a symptom of something else until proven otherwise, right? So, and as you both also alluded to, like, you can go through specialist after specialist after specialist and still not find what the problem is. So, yeah, I mean, I don't, yeah, that's tough. That's really tough. I don't know. I don't know if there is a good explanation for that at this point.
So then because we kind of like delved off a little bit. So I guess, and sorry to cut anyone off, but to go back to the physical manifestations that you didn't touch on yet, because you were talking about how it's important to rule things out. So once we ruled everything out, I would say, like, a good way to kind of explain it is like 50% is, you know, the vestibular, 50% is in our heads. So I guess with a patient like that, roll with it?
I mean, I think the problem is that your body knows that you're not supposed to be dizzy, right? I mean, I think that that's pretty fair. Most people don't exist. You didn't come out of the womb feeling dizzy, and so when something occurs that causes you to be dizzy, you know, that being whatever the mechanism of your vestibular migraine illness is, that would make most people anxious to some degree, or cause that to be all in your head, like you said. So I don't think that it's fair to say that it's all in your head, so to speak, but I do think that there is a huge anxiety component to these sorts of things, you know, just because you're dizzy, you're nauseated, you're off balance, you know, those sorts of things. So, I mean, I think that I don't think that there's anything wrong that could come of, you know, moving down that pathway to treat that anxiety, definitely, because that is something that there are multiple different methods, you know, for treating, where there's really not a really good standard of care for managing vestibular migraines. So, but what were you asking beyond that? I'm not really.
Just like how just anxiety in general can cause basically like our symptoms and stuff, like, if that makes sense.
How? Jeez.
Yeah, like
in there, Kelsey.
I
Yeah.
know I'm being a little generic here, but I'm basically trying to like get at like what you told me and how you explained to me of like how. Okay, I'll give you an example. So last year, like everything was really bad for me, like all of like my symptoms, I couldn't control it, that sort of thing. But when I decided to not be on medication, my mind started to kind of take over and try to like compensate for everything a little too much, get a little overstimulated, you know. Every little thing was like a trigger to me. Everything. Somebody could look at me wrong. I was busy. And like, so I'm just saying like mainly, and like the derealization piece and stuff like that. Like how would you explain like, you know, like anxiety causing these physical things, you know what I mean?
Yeah, so I mean, you have to understand, like, when you get into a state of anxiety, it's your body's pumping you full of epinephrine, and so your heart rate's going to jack up and increase. A lot of people experience visual changes. You might experience shortness of breath because of that abrupt increase in your heart rate. There's numerous physiological things that happen in a state of anxiety, and so as these things happen, it's easy, especially if we're already anxious, it's easy to start to pinpoint different things that we're feeling, and then presume that it's something beyond the anxiety that we're having, and then that just kind of causes things to continue to manifest like a snowball effect almost. I'm trying to remember. There was a okay. Sorry. There was a time that Kelsey, if you don't, do you mind my sharing like
go for it. No,
okay. So there was a time that Kelsey had experienced an episode of like she thought she was having a heart attack. Like she was what, 21 at the time, 20 at the time. Yeah, she was young. I mean, that's not a standard age to have a heart attack. But she was, you know, she was having pain in the middle of her chest. She was having pain down her arm. She was having tingling in her arm. She was short of breath. She was nauseated. She was dizzy. And so, you know, I mean, the extent to which, you know, being in a state of real increased anxiety can affect your mind is really I don't want to say limitless, but I mean it is to a degree. I mean, if it's allowed to kind of go out of control, I mean, you'll think that you're dying every time that you have an anxiety attack. So that's why when I had talked to Kelsey about this, like, you know, it is really important to do, you know, to take initiative and do what you can in terms of managing aspects of mental health that are certainly important for everyone, but also especially if you are, you know, you're experiencing symptoms that can't be managed otherwise, you know. So
yeah, for me it was hard because I never had any anxiety or panic attacks before these happened. And then
before you started.
Yeah, before I started with BM. because first started like vestibular neuritis, I think, and it was hard because that's how it started with anxiety, and never in my life had any type of anxiety or panic attacks or anything, and that's how mine started. And it was very difficult for me because like I never experienced it, and then out of the blue you get this stuff and you do feel like you're dying, but it took a while to get diagnosed. So I still deal with it, and I decided not to take medication, so sometimes are very difficult for me. But most of the medication that had given me has making me worse, so I had to go to the ER. And that now I have fear of medication, which they all know that. And I mean, just hoping that one day one medication is gonna work, but now I have fear because the other ones would make me feel so bad that I couldn't take it.
What were they, if you don't mind me asking, what were the medications for? Are you talking, they were for anxiety, or were they for?
I mean, most of the stuff that they give you for migraines are for like, medications either for blood pressure or seizure stuff. And the last one that they give me, I don't remember. I have to like look it up, honestly, because I have brain, problems with the brain. But most of them were antidepressants, or the last one that they give me, I think it was propanol, is it?
Yeah, it's propanol.
Yeah, instead of like, you're supposed to be for blood pressure, but a doctor said that it helps people with migraines. So after having the baby, my second baby, I started having headaches. When I got BM at the beginning, I didn't have no headaches for years. So 3 years ago, I started having the headaches. So now the doctor wanted to give me medication. So he gave me propanol. And instead of like, keeping my blood pressure down, I never had any blood pressure problems in my life. It raised it up to a point that they were like, you need to stop.
Yeah.
So it's kind of like Dr. Haynes, which is the doctor that I see, he's like, oh my God, all the medications that I give you, instead of like, they make you worse. Yes, baby, yes. I'm sorry, I have a baby.
No, you're okay.
Oh, okay. So yeah, it's very difficult. And now I'm so afraid of taking medication that, I'm so skeptical about everything, and I admire them because they actually do something about it, and now I'm afraid.
No, and I think that's very reasonable because there's very little medication-wise that people can take that won't cause some degree of side effect. There are very few drugs that are you'll take that won't give you some sort of side effect. So that's reasonable. I don't think that's.
I mean, I had a list, but I had to look it up because I just stopped. Once these happened to me with the propanol, I'm like, I'm not taking anything anymore. So now I'm looking.
That was a terrible one for me as well. That didn't work for me.
It was horrible, especially because I never had any blood pressure issues in my life. And then now I have a new experience, and the BM brain is very sensitive. So, it was almost like adding a new thing to my problems already. It was very scary.
Yeah, that's the problem with the meds too, though, is they exasperate the symptoms, if that makes sense.
Right.
You know what I mean? So that they're actually worse.
On top of the side effects.
But then again, for someone like me with anxiety disorder, all you have to do is, and like all my doctors, they wouldn't even tell me the side effects. They would just say, take it and don't read the side effects. And I'm like, do you forget who you're looking at across the room at? Because I'm going straight to the, I went straight to the black box. I mean, and they're like, how do you know about the black box? I'm like, you don't need to be worried about it, but I'm going to know the worst ones, okay? And I would always have the worst ones, and I think it was a lot of my anxiety,
Well, that's
I could never look at the side effects. I'm just like, I'm taking it. It's going in. Let's see what.
No, I always look at the side effects, and but then I had to tell myself, okay, you're looking at the side effects. and they're really not like bad side effects unless you look at the black box, and then you're going to get the really bad. So you don't even want to know what's in there.
There's a chance of killing you. Yeah.
There's a chance. Oh, you don't even want to know what's in the black box side. So yeah, but and then finally I was just like, okay, everybody else is saying just keep going, take the med, keep going. And I think that's how we all have supported each other through the medication part of it, because we all know what's going to happen, that there's going to be, you can have side effects from a Tylenol.
Yeah. It's interesting too, because a lot of like your antidepressants or whatever they'll put you on for anxiety, a lot of the the gabapentins of the world, a lot of those things, when you start taking them for the first couple weeks, maybe even months, you're going to have like these gnarly side effects, and a lot of people will stop in that period of time before they even start to get any benefit from them. And so that's one of the problems. I mean, when is your name Tirsa? Is that it?
Yeah.
Tirsa.
I'm sorry, like I can't. I'm on my iPad, so
It's okay. My name is weird anyway.
No, it's okay. So, like you were saying, I mean, it definitely tends to make you really skeptical of trying, from trying new medications, because you've gone through medication and you've continued to have these really frustrating side effects. So that's unfortunately, it's when you're putting drugs into your body, although they're supposed to help, right? They tend to cause those problems up front.
Yeah, it's difficult, but it took me a long time to, I'm never going to be okay with having this problem. I don't think I ever going to accept it, but now I'm more calm about it. I feel, my anxiety has lessened too, because now I have them to talk to. I'm not the only one. I don't feel like I'm going crazy. Makes it better.
Right.
But because I never have any anxiety problems in my life, so definitely during the time where I didn't have nobody to talk to, which was many years ago, because I just barely found them. Yeah, it was bad. It was very bad, and it's been a long time and a very lonely journey.
That was something that I struggled with the most, is like, as you say, like you never struggled with anxiety problems in your life before this. I was more or less the same way. And then I started working with a psychologist and like really digging into it. And I realized like how hyper like my brain has been my entire life until now, like how much anxiety really was there, that I was just kind of like, oh, that's not a real worry or something. I'll just put that aside, So we started unpacking it. Like I've been hyper, like I've been so hyper, like my mind has been so active for so long about things that I didn't associate with it.
No, you were just functioning with anxiety.
That's what it was.
That you were just functioning with it. Like I functioned with stress and blew off a lot of symptoms until I got slammed.
Yeah.
And then you can't blow it off anymore.
Yeah, maybe that's what happens to me, because growing up I didn't have an easy life. I grew up in El Salvador. There was civil war, so there was a lot of ugly things happening around us, and very close to me, seeing a lot of dead people. And it's ugly, because no art is pretty, and I was very young, and I remember being fearful, but not like to a point of getting sick, and
maybe
then
not till later.
Exactly. That's what, now that Jeffrey said that, maybe that has to do with the anxiety now. But you deal with so many things through the years, and you think that you're so tough, and then out of the blue, something happens, and but I wasn't going through any dramatic experience or anything. The only thing I remember was I was always very active. Like I could never stop. I was always go, 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 go. And I started feeling tired. Like I would get home from work, and sometimes I didn't even want to go work out because I was exhausted. And that was a weird thing for me, because I never felt tired in my life. you know, I mean, you feel tired, but not to the extent that you need to take a nap. And like, you know, that was me.
Yeah, it
So
almost sounds like chronic fatigue was setting in, and
yeah,
that
I
was
started
your
feeling.
beginning.
So I went to my doctor, and of course he's like, well, it's probably stress. It's probably stress. But, you know, it was just like, dude, you need to understand. You know, I don't get tired. You know, this something else is going on. He's like, well, I'm gonna take some vacation, blah blah. And then like 2-3 weeks later, I started getting dizzy. And
Yeah,
then,
see, that was the start. That's what I always wonder too, is if this is really a virus of some kind that we all have.
well, that's what the doctor, because I have a little bit of damage in my ear, like nerve damage in the ear. So Dr. Hain thinks that I had VN and stayed there. But I never had ear pain. Never had ear pain. Now I do. Sometimes I get these really weird, like stabbing pain in my ears. They last maybe a second or two, and then they go away. But ever in my life never had any infection growing up. I don't know what it's to have, you know, nothing like that. Never had any problems with my teeth, because people always, you know, some people have with the, you know, the TMJ stuff, and never had any problems like that. I was so healthy, and I was in the best time, like with me, like working out, and a good diet, you know, very healthy, everything. And this happened, and I could never understand how. I'm never going to understand how. I just remember feeling tired and then telling my doctor, this is not just stress. This is different. So I think sometimes I'm like, maybe he wouldn't done a blood test that day and check for infections, or I don't know, you know, but it happened, and now I'm disabled because of it. I cannot work. I cannot drive. And it's frustrating because I was very young. I was 30 years old when this started happening. And, you know, now when I'm not that young anymore, but but you know, now 10 years later, you know, I'm able to accept it, but it's been very hard. It's been so hard.
So this vestibular migraine thing, this is a real thing, right?
I mean, that's what I think
That's that. I
all the
mean,
time. Is this actually?
is this a real thing? That's what I mean. He's in med school, so I'm
tough.
thinking he would probably know if this is a real thing.
I know that. I'm thinking to myself.
I mean, sorry.
Are we crazy? Are we just imagining? No.
No, we're not all imagining this, okay?
No, you're not. I think so. Uh, it's kind of tough. Like I said earlier, there's not a lot of really solidly known things about migraines in general. And I think that there are certain instances where, you know, from the medicine side of things, you know, things have been ruled out to the extent that we're able to rule them out. Because there are unfortunately limitations to what we can and can't test for, and you know, what we can and can't diagnose, you know, with any sort of surety to it. And so sometimes, you know, so sometimes there's things are diagnosed that might not have any sort of, you know, like, this is the diagnosis, but where do we go from here? That's still kind of unknown. And so, like, from talking to a couple different professors and researchers, like I was telling you about earlier, that's kind of, I think that's kind of where things are sitting right this second. But you know, that I don't really know how to expand on that any further,
Because my other question was if it's vestibular, which, like, my whole life and probably everyone's whole life that's in this group right now have been told that if you have dizziness and it's considered in your ear, or you're off balance, that's considered your ear. You know what I mean? Does that make sense? Mm-hmm. But then you go to, like, my ENT and did extensive testing, and the last test he did was that V hit, it's called. I can't remember what the V stands for. but it's a very specific test. And it was able to tell him specifically that there is absolutely nothing wrong with my ears. My hearing's fine. The nerves are fine. There's no tumors. There's nothing. So he attributed it to the vertigo side of your problem has basically healed itself to a point, but your anxiety has perpetuated. So now you have vertigo because of anxiety. And I'm like, okay, this still isn't making sense to me because my right ear has like muffled sounds in it and pops, and you know what I mean? So it's like, okay, there's obviously a problem with the right ear, but he says no, all the tests that he's done. I mean, I've done like 15 tests with him and there's never any problem with the ear. So if being off balance and dizziness, like they tell you your whole life, is from your ears and there's nothing wrong with your ears, how does the vestibular migraine, where does the vestibular part come in, is I guess is the question.
So the term vestibular just kind of refers to your body's ability to be in balance and not be dizzy and
Okay,
function in a coordinated way. So it's just a term. It doesn't necessarily refer to it's related to your inner ear.
Okay, that was my question. Yeah, because he said also your muscles, your skin, your nerves. He said all of that tells the vestibular system where you are in space. Is that correct?
Right.
Okay.
But the vestibular system is on the brain, right?
It is, yeah. So it's kind of so the vestibular system kind of originates from the inner ear, which is why a lot of times they'll tell you that you have a problem with your inner ear, even though, like Patty was saying, you don't. So it originates in the inner ear and it travels through to the brainstem, but it receives a ton of sensory information from all over the body, really.
So yeah, so that means the body, if you, like me, I feel like I'm walking on a trampoline. Obviously something's off in either my nervous system, which is usually where it is because it's anxiety. You know, I can tell the difference now. I'm starting to be able to tell, like if I'm anxious, like really anxious about something coming up or whatever, I'll get a different kind of vertigo, let's call it. Not my normal, whoa, I'm dizzy vertigo. It's a different kind of vertigo. It's off balance. Things don't look right, you know?
Sure.
And then after the anxiety's gone, it's gone. And then the other stuff comes back because the anxiety was there. So it's like, oh my God, just shoot me.
Yeah, no, it's so many. There's like also the eyes. The eyes have much to do with it because I cannot focus just on one part. Like when I'm having a conversation, I try to look at people on the eyes, but it's so difficult for me because I use my eyes for balance. Yeah. So
you have to look away like every 5 seconds or something.
Right.
You know, it's so uncomfortable. Like now, I'm looking at you guys, but at the same time, I'm not, because if I stay focused on just you guys, everything else will start moving around. So I have to be, checking everything around me. So then I get the migraine, the migraines in my eyes too, like, the pain under my eyes, because I use my eyes so much for balance. And it gets to a point where I see things like, I feel like I'm very tall. Like I'm very tall. And the floor feels like, so Dr. Haynes said that that's like Alice in Wonderland.
Alice in Wonderland syndrome.
Yeah. And I'm like, oh, great. That's one more thing that I needed. I don't need that much stuff, I don't need that much stuff. But, it's horrible. It's horrible. Like every single thing, like when this started for me, I was able to drive for maybe 4 or 6 months. And I was very dizzy, but I didn't have the anxiety. I was just feeling the dizziness, the off balance feeling, but I was able to drive. And I was going to physical therapy for because the neurologist that saw me thought that it was crystals. So she's like, oh, you're going to be fine, blah, blah, blah. So yes, the therapy was helping me. but they needed me back at work. You know, after 4 months, 6 months, they're like, okay, you need to go back to work. And I remember very clearly that the girl told me, don't go back to work. You need more time. You need your vestibular, like your balance, whatever. She tried to explain everything to me, and she said, don't do it. But they were putting so much pressure at work that, they were like, okay, we're gonna have to let you go if you don't come back. So I was like, okay, I can drive, and my job was working for the lab. So I had, I was picking up the stuff for the labs. So I have to drive all over Chicago doing this stuff. And as soon as I did, I was never able to drive again, because the dizziness was so overwhelming, that I couldn't. No, eso no es basura. I'm sorry, guys. It's just. CI. So yeah, and she was completely right. And now I cannot even work. After that, I couldn't keep my job. I had to quit because they were like, well, you either drive, or they were not accommodating with me, or, nothing. So I ended up having to quit, and I lost everything. And it was very difficult. Yeah, I don't even know what I was saying, all these things. a brain fog moment for you.
No, that's all right.
It's hard because the baby distract me. So yeah, but I have so many symptoms, like crazy symptoms that I couldn't, I felt electricity in my body. Like real electricity from my brain to my toes. And I would feel it in waves in my body, like all over my body. It was like somebody connect me to something, and I was getting shocks all over my and it was not seizures because I got checked. They did a lot of tests with neurologists where they connect things on your feet and on your, around your to measure electricity, whatever it is that they measure.
Nerves. They were measuring nerves.
I don't know. I'm not a doctor, but
it sounds like nerves.
So much they connect me to cables everywhere to check it out, and they never could have figured it out. My body was doing it, and nothing would show up, but I was feeling all these things horrible. Now I get more. Eventually, with the years, it started to calm down because these things were waking me up in the middle of the night. It was day and night for 4, 5 years, all the time. It was horrible.
That would have drove me nuts.
I thought I was gonna go crazy. Where were you guys in that time?
I didn't have it 4 or 5 years ago.
I didn't know what the hell I had.
but I remember thinking oh my God, I'm going crazy, and if I don't know. I don't even know how I survived these things, honestly.
One of the questions I had that my doctors had brought up several times too, I'm not sure if it's necessarily in relation.
Fakers.
But how there can be a certain trigger for something that causes your brain to go into a reaction, and that initial trigger or whatever caused it go away, but your brain just continues, that reaction to it forever, basically.
That's it. So what was do you remember what in particular was causing you to be triggered by, to experience whatever symptoms you were experiencing at the time?
I'm trying to think. Rephrase that or ask again.
Do you remember what was triggering you at the time?
No, we don't. That was just a theory we had, that there was something that at the time this started, even though we could never figure it out what it is. We went through my life, we're okay, so what was I doing this day? What did I remember around that week? Do I remember walking anywhere? Do I remember driving somewhere? Do I remember something at work? Do I remember something at the house? We were going through all this and, trying to look for 6 months before, and we couldn't think of anything that was really out of the ordinary. But there was just this thinking that there was something that had happened at some point that set off a reaction, where your brain was trying to fight against it, and it just wouldn't, that initial thing was gone, so it would never figure out what it was. But that was a couple of doctors I had were kind of mentioning that, and I'm not sure if, what that really was or meant, or what they were looking for, what they were thinking about, but it's an interesting theory.
Yeah, that is interesting. I mean, it's certainly possible. It's I don't know. I'm not really in a position to speak on that. Which unfortunately, I'm sorry, but yeah, that's definitely an interesting theory for sure.
It's horrible.
Yeah.
Because I mean, even like we looked at like trying to think of like if carbon monoxide poisoning had started something, or because the symptoms are very close to that too.
Yeah.
And then I don't know. It's just there's a bunch of stuff that even like I don't have like the intrinsic factor or whatever that digest B12, so like my B12 level's low, and that was causing all kinds of weird neurological things for a while, and that kind of went away. And then like this all started like 3 years after we figured that out, so we don't know if there's any relation to that or what happened.
Yeah, isn't that weird? Because you think about it, what if it was something from 5 years ago? How the heck would you figure it out?
Right?
Yeah.
I mean, you almost can't.
Yeah, exactly.
I mean,
there's so much related to the I guess to the neurological. Well, I mean everything's really connected by the neurological system, but there's so much stuff that's outside of like the traditional like looking for migraine treatment and things. Like you look for vitamins that, or there could be some sort of environmental thing that you would never think of that's causing it.
Yeah. Now
you also have to wonder too about all this technology.
Yeah.
Because think about what we're around all day: phones, computers, the TV,
stuff.
and it's in all the air around us constantly. So it's like, could it be that?
Hyperstimulation over a long period of time.
Right. Which I know I had hyperstimulation just from anxiety. Because I think Kelsey and I are the one out of the group that have the anxiety, other than Natasha.
Well, I used to be very bad too. It's just that with the years, by myself, psychologically, me helping me alone, I have been able to calm down. But there's days that I still feel weird.
Yeah, and me too. Like I'm the exact same way. Like I still, like, even though I'm on an antidepressant, an anti-anxiety, whatever, I mean, like I still, like, for example, yesterday when I was about to meet up with that girl, I got like derealization feeling because I was getting so overwhelmed and I was like nervous and like, this is like human contact, red alerts going on in my head.
Oh yeah, and then what if something happens or what? Yeah, all the what if.
But you were gonna meet up with somebody?
Yeah, I actually was telling Patty that. Hang on one second. Sorry. There was this girl that I met actually in the vestibular disorder support group, not the professional group, but the other just regular support group. And she reached out to me last maybe last September. And she lives in Michigan too, and she lived like 4 hours away or something like that. And kind of like, I need help. Like, I don't know how to do this. Like, school's hard. And she's like, I saw that you're in college too. So she's like, maybe you can give me some tips and insight and stuff. So
Caballo otra vez?
And then we just stopped talking for a while and then started kind of rekindling again here and there. Well, she messaged me in August, because we haven't talked in like months, saying that she's coming to my school that I go to. And she's like, yeah, I'll be living like right in East Lansing, which is where I live. And she's like, or I was like, oh, no way, that's really cool. Ask her where she lives. And she's only like 5 minutes away from where I live. So, we've been kind of making plans to meet up, and either she's sick and doesn't feel good or I don't feel good. So, I finally yesterday, she's like, I don't care if you don't feel good and you don't care if I don't feel good. So she's like, I'm just coming over, and she's like, we're going to hang out no matter what. So she finally did, and we've had like plans to do stuff. We ended up just talking for like 4 hours straight. about just like everything we've gone through and stuff like that. And it was really, really nice to like talk.
Oh, that's nice.
You know, and like it was cool. So, but yeah, I've just been putting it off because I was just scared of like, you know, looking normal or having to be normal in front of somebody. Like that's always like my fear is like.
But how can you be looking normal to somebody that has the same thing you have?
Well, I know, but I was just worried because she seems more like she handles it better or is back to normal kind of thing. But then she's
like to me, it's kind of like I handle it better than a lot of other people, but there's other people that are gonna be worse than me. So you just have to be understanding. We're all in different levels of how we feel, you know, and but we still have the same diagnosis.
Yeah.
So it doesn't make it any better for me or for you. But there's days that I feel like, okay, I don't have the anxiety. That's a good day.
Yeah.
Because anxiety obviously intensifies everything in your body, right? Mm-hmm. So when I don't have the anxiety, even though I'm dizzy or I have a headache or, I'm having all these weird ocular craziness that I get here and there, or the numbness on my face and my gums and all those pretty things, then I'm having a pretty decent day. Once I get the anxiety, then it's like
over.
Okay, go to hell day because I can.
Yep, I'm good if I don't have anxiety. I'm really good. I don't care how dizzy I am as long as I'm not anxious.
But it's all, and I get like I don't get anxiety all the time, but there's times where my anxiety can be as simple as like tomorrow I have to get up because I have an appointment at 11, and it's kind of like, oh, I gotta get up more earlier than usual to get things ready, and like yesterday, I thought I was not gonna be here today, but my family decided to come yesterday, but I wasn't expecting them to come. So I literally I was thinking, okay, I'm going to put the baby to sleep. Oh, my God. Sí, mi amor. She's watching Spirit, the stallion one. Mm-hmm. And she's crazy with the horse. So she wants me to look at the horse. Sorry, guys, but she's so loud. Oh. Anyway, so my thinking was, okay, I'm going to put the baby to sleep. And I'm going to take a nap because I really wanted a nap. And usually when I nap, I don't feel better after. But, that's what I wanted to do. So my mom, she fell asleep super late. And I was like, okay, I'm going to sleep. And then my mom called me and she's like, I'm coming. And your brother is coming.
Nice.
Like,
well, at least you didn't have time to be anxious about it.
No,
right? It just happens. You're into it.
Yeah.
An hour, because my thinking was I'm gonna take a nap and then I'm gonna worry about everything else.
No, you're not. Now you're gonna get dressed and get ready for company.
Take a shower and like a hairy. I didn't do my hair, so it's all like, and I'm like, I like it. I like the stuff. It's kind of like you put me in a situation. Like they forget that I need time. And for them it's like, oh, don't worry, we're gonna be there in an hour. What can I do in an hour? I had BM, I had to take a shower and I had to.
You brush your teeth, you throw on a little makeup, and you move forward, babe. Because that's all you can do.
So anyway, I took a shower. I just put my head up and, I didn't even put makeup. Like now, I don't even care. But I took a shower because, it was my time to take a shower.
I would have thrown on a little makeup and brushed my hair and said, screw it.
Yeah,
I don't even care.
But it was hilarious. And then my brother was hungry and his girlfriend too. So guess who cooked?
Oh, no, they didn't even bring food? Oh, no, I would have said order, bitches.
No, the thing is that
I had delivery.
I had everything like prepared just to put it together, but I was missing the tortillas. And I don't have a microwave to like warm up the tortillas. I mean, it was a long process. And then I was done giving them food and I'm like, okay, I'm going to sit down and finally have a nice, decent like meal. And then my boyfriend comes home.
Yep.
So I was the last one to eat. I was already passing out hungry. And, you know, and I was overactive. So now I'm dizzy.
Oh, my goodness.
Because I was back and forth cooking and doing all these things that I usually don't do for so many people.
Yeah.
So it's difficult. It's difficult. And then I get anxiety. So today I was like, you know, I did go out last night.
Oh, good.
And
That is good. That's really good. It's important to do that, you know? Like, it's
we went to his family's place and we had some wine and it was fun. And I came home at 1:30, which is like,
Holy crap.
no. And these babies stay all the way till that time. I cannot even believe how much energy she has.
Oh, my God.
But the thing is that they have a 4-year-old, so she never has nobody to play with. So having another little girl was like heaven.
Oh, yeah. Oh, yeah.
Oh, my God.
So we stayed that late because we wanted her to like play because that
Jeez.
doesn't happen often. I don't go out too
I'm
much.
so jealous. Y'all can actually like go out and do something.
Well,
I haven't been able to, like, I can't even go to a restaurant. Like, I haven't been able to go out for 4 years.
I was
No, you're kidding. All you do is go to work then.
I go to work and come home, and like if the closest thing I'll do is have someone like stop by, or we'll go get takeout and come back to my place. Like that's the only thing I do.
this is as I understand you because for many years that was me. And but the difference is that you work. I didn't work. I couldn't.
Well, I have to, or I lose my doctors and I'm screwed. So
Question, Jeffrey. Like, explain to me what happens, like, if you were to go out. I'm not talking about, like, you go and get wild and, you know, get drunk and stuff. I'm just,
Yeah.
like, literally, like, if you...
immediate brain fog, spots in my vision. I get to the point where I'm about to have like an onset of one of these like crazy anxiety or whatever migraines.
Yeah.
So like I start getting dizzy. I start having lack of feeling, and like I lose the proprioception of where my arms are. Like I don't feel that they're attached to me anymore. I can't speak. I can't understand anything anyone says. I basically just become a zombie, and I'm like, the only thing I do is like take me home, and like I slur that because I can't talk.
Have you told the doctor this stuff?
Yeah.
You think, Jeffrey, is probably all the stimulus around you, the lights, the noise.
It's the audio, and it's anything with sound and with sight. And if there's anything like there's bright individual points of light and the rest of the room is darker.
Oh yeah.
Or if there's any sort of flashing or changing light, if there's any more than like one conversation that, like if I'm having a conversation with someone and I can hear anyone else talking in the room, it immediately sets it off. It's like meetings at work. I have to like tell people like straight up, like while people are talking, I'm like, be quiet. I can't hear more than one conversation. Or like I'm busy. So, like in a meeting with 30 people at work, I have to like yell across the room. I'm like, stop talking. Because it sets me off so quick that like it can be
that was me.
That happens, and it can it can be 30 seconds and I'm done for the day.
Yeah. And you know what used to happen to me too, that whatever you describe right now, it would have happened to me even if I go to the store or if like anything that was outdoorsy that will make it like my eyes get it stimulating, my ears, the noise. Like I couldn't stand outside and listen. Like now I can tolerate a little bit more, like the noise of the cars, the smells, you know, all those things were triggers for me too to feel worse. And for many, many years, I exactly felt like that. Like I couldn't understand people. I was stuttering a lot. I mean, I still get brain fog. You can see when I'm speaking, sometimes I just lose it. And I feel like
it's pretty much immediate. Like it happens in 30 seconds.
Okay.
And I'm just done. I'm done for a day.
But with awful.
And then I would come home and I was so tired.
Yeah.
Like I did so much and I just probably just went for a little walk. Okay. And I felt like I needed to sleep and close my eyes and not talk to anybody and like literally silence, completely dark all the time. That was me for like 5 years.
The closest I've gotten is like there's 2 restaurants I've found in town that are basically completely black and have like sound absorbing material everywhere. So like I can get into a corner, like ask them to turn off the music and like whatever. And like that's the 2 places that I can actually handle going out to eat. And it can only be with one other person or maybe 2 other people.
So you would do very bad with all of us together.
Yeah.
Uh-huh.
Yeah. usually when I'm doing these group stuff with you guys, after I'm done, I'm very disoriented for a while.
Oh yeah.
So am I.
That's the
So
last
am
thing I
I.
do for the day.
So I just put up with it because it's nice and it feels like I have a connection. I wanna be, it's the only time where I can talk about how I'm feeling and nobody looks at me like, oh, you're nuts.
Mm-hmm.
Yeah, I was curious about that. If you guys notice that when you get off of these video chats, if you're busy afterwards.
Very much.
There's a lot of times like I just turn off the video part of it and just look at a white screen here.
Yeah, it's hard because we're moving, we're moving. I move a lot. I have the baby, the noise of the baby also. But unfortunately, I don't have babysitter.
Yeah.
So, but I get it. Like even me, like right now when she's screaming, I can feel it on my brain, like somebody's screaming inside my brain, and it's kind of like, ah. But I put up with it. I have learned to cope with it, but it's still difficult. There's some times where I get very grouchy. Like I feel like everything gets me upset, and the noise, like that other day, my neighbor with the music so loud in the middle of the day, and it's kind of like
I would have been banging on his door.
Out of my control, Like I have these other like these people here beside me that eat a lot of, I don't even know how to say that, curry, I don't know. The food, the smell of the food.
Curry.
Yeah, that thing. I cannot even say it. Whatever. And the smell of the food comes into my apartment sometimes. If I open the window or if I open the door for a second or two, and it's just overwhelming. But I cannot just go there and say, hey, don't cook your food. That's rude.
Yeah.
So I don't know. I just learned how to put up with things, and like when I'm in a place where it's too much noise, I get quiet, and then I try to, like calm down and think like, okay, it's gonna be okay. It's gonna be okay. But it's hard. It's so hard, Jeffrey. And I understand you. And it sucks that you cannot, do these things.
Yeah.
I understand you, man.
Yeah.
Been there.
So, Bronson, are you still there?
Yeah, sorry, I turned off my video. I was eating.
Oh, well, that's all right. Kelsey eats all the time.
Oh, yeah, well, no, we eat all the time on here.
Oh, yeah.
Because I was surprised Kelsey wasn't eating.
Someone will start eating. Someone's making dinner. I'll order dinner.
I was going to say really, really quick. I like totally understand you too, Jeffrey and Tirsa. Like, obviously you didn't know me back then, Jeffrey, but Patty and Tammy did, and like I wouldn't leave my apartment. I was basically bedbound. I had my boyfriend bring me everything. Like it was horrible, and like I totally understand like how you feel, because like anytime I go anywhere, like something simple, even to go grab my mail from the mailbox, like I couldn't even do that. That alone was stimulating, and it was like that feeling like you don't have, like I felt literally like my brother Bronson, even like I told him all the time when I lived with him, like I felt like my legs were like sponges, and like they would just give out at like anytime like we would go out to dinner together, go out to lunch, and like I'd be talking to him and having fun, then literally like a snap of a finger, he'd look at me and he was just kind of like this to me, because it was like I wasn't even there, and it was like my brain just shuts off. And the thing that helped me, like he helped me a lot with this part, but was obviously like learning to kind of, and it's hard, it really is, and I'm not at all trying to minimize it, and I'm not trying to make it sound like it's just a cakewalk, because it's not. It is hell, it's hard, and it's difficult, but pushing yourself, and I am biting my tongue as I say it, but like every day, like if you just try to just like, because for me,
exposed.
Trust me, I do.
Very repetition work that you have to do, and it's very self motivation that you have to do, and like working with the therapist, because like my therapist like was willing to like come with me and like walk with me and be there with me and stuff, and like and then that's when she told me to use like a cane, and that was another step that helped as well. Obviously, I've said this a million times, but it really did. And like using that, so like when you feel like your legs are going to give out and you have this sturdy thing in your hand that you're like, no, this is physical, real, structure that you've got versus the love that I feel like are going to give out. Another thing is those motorized wheelchairs that they have at like several stores and, you know, whatever, department stores, whatever. And you can take those and ride around on them, and you don't have to worry about walking or feeling like you're going to faint or that, you know,
That's horrible.
I can't say it, but it's a proprioception, I want to say.
Yeah.
Yeah. That feeling is eliminated essentially, you know, by something that you're not in control of anymore. You're not in control of your mobility because you're using something that takes away that feeling, you know, and that's what I think is important too, is like that, like the movement is just such key though. And like
that my threshold for like being therapeutic and being absolutely murder on my body is so thin that it's impossible for me to tell.
That's the problem, is getting the threshold back up
so
to where it needs to be.
that's
it's
exactly
so narrow
what I'm
for me.
talking about.
When you go out, do you have any friends that can come up with you so you can, you know, you don't feel like you're alone? And
No, I never have a problem with that because I know enough people that live around here that like I have them in my phone. I can just like dial up and be like, hey, I need a ride home. And I've done it. Or I'll use Uber or something or whatever. It's not a problem. I've never had a problem with that. But it's just whatever it is. There's just such a thin line for me.
I know,
yeah. I'm sorry that you're feeling.
I know.
So yeah, it's like yeah, and it's hard because I'm pretty motivated to push myself with this. Like being the therapist and like once they taught me how to do things and what to do and like, you know, push yourself until you feel that it takes this long to recover from it. So like when I started, it's like very minimal things like, okay, do this and wait 30 minutes. Do you feel normal again? Okay, we'll do it again. You know, like keep pushing that, maybe push it a little further. And do you feel bad? And in, you know, 4 hours, I think was what we determined, is like do something until you get to that point where you're going to feel bad for 4 hours. But like after the end of that 4 hours that you're okay. And so like I would work on that and then push that further and further.
I used to get so tired that I would sleep for hours, sometimes days, 3 days, and I was in bed all the time.
Yeah.
And
I've never done that.
Oh yeah. Well, you see, we're all different and with different stages and everything, you know. So, but I do know that it's difficult, and I remember going to the stores with my mom holding my hand, like literally like a baby, because I couldn't cross the street or anything. That like even now I like where I live because I have the hospital like a block away. I have a grocery store about a block and a half away, so I can go walking. But you know, sometimes I'm like, oh my God, I had the baby, and if I go walking and I get dizzy, and the street is very busy, you know, the fear of, oh, I'm gonna faint in the middle of the street because I'm feeling like the wobbly legs, you know, and things like that. So I sometimes I do push myself and I do it, and then I'm like, oh, okay, I went walking and it was okay. But you know, it takes me forever. I can do that maybe twice during the year, but you know, I wish I could do it. Like yesterday, I needed tortillas, and I said, okay, I'm not that dizzy. I can probably drive. That was in the morning. I can probably drive to the store. But then as soon as I thought about driving and crossing those streets, because I have two major streets, like they're big streets. And I thought about it, and right away I start feeling like nauseous and
yeah, that's the anxiety.
Yeah, I know.
That's definitely anxiety.
Anxiety, and then I couldn't do it. And then I'm like, okay, I'm just gonna wait until, you know, my boyfriend comes home, and then I'm just gonna go with him to get tortillas, because you know, once somebody goes with me, then I'm okay. But you know, I try, and I have done it. Like I'm trying to get in the car, even though I feel weird. Like yesterday, my mom went with me to get money out of the bank, and I drove to the store with her, and I drove, and it's only like 2 minutes in the car, but you know, to me that's victory, because it's like, and I felt very sick when I was doing it, but because
I don't trust putting anyone else's lives in danger for me to drive them somewhere.
No, but I mean, it's close by, it's not that bad, but it's just like what I was saying, it's the point is, like, it was good for me because she was there with me, you know. When I'm just me and the baby, it's kind of like, oh God, it's worse, because she's not gonna, you know, tell me you're gonna be okay or anything. She's just gonna see me and start crying or something, and she's gonna freak out. So it's kind of like I have so many, like I have to learn
I
how to
think
stop
the
those
biggest
things.
difference for you is having the baby, I think, or like with Natasha, with her, like when she's with her kids.
Yeah.
That adds a whole new level that I don't have. So
Yeah.
like with me being alone or not with someone, it doesn't make a difference to me. Usually being with someone just makes it worse because then I'm worrying about them worrying about me, or
Yes.
I have to listen to them talk, and that upsets me quicker, So
So you're better off alone.
yeah, better listening to people is the biggest thing for me that just hasn't really improved.
Yeah.
Who's throwing things? Who's destroying the house?
It's probably my dog. Sorry.
Oh,
Oh my
I'm
God.
like, I hear who says dogs? Oh, you're back.
Oh yeah. Sorry.
Oh, okay.
Yeah,
Yeah.
he's done eating while we were all over here starving still.
Oh
Yeah.
yeah, that looks familiar. Very familiar. What a miracle! Did I came too late because Kelsey's not eating?
Yeah, because Kelsey's always eating.
Every time we get
And
together,
Tammy's not on
every
track.
meeting
Great
she's eating.
That's,
That's
when
funny.
she's, like, really not feeling well and she's not eating. 'Cause she's yeah.
Yeah.
Yeah,
Yeah.
she likes her food.
Patty.
She does.
and it's always something so good.
That's good though. You like food. See, I'm the opposite. I'm starving all the time because if I eat almost anything, I'm triggered. So it's like I'm starving. I need something
Well,
to eat.
now that you're back, I'll have another question for you here.
Oh.
I'm just curious, like, what is your motivation for what you're doing and studying, or like, what's the thing that excites you the most about it that really drives you?
Me? No, I'm kidding.
Geez, get in those deep questions. God.
Yeah, I know. I just figured,
Right on, dude. No, that's cool. I think so. It's kind of multifaceted. So I'm a paramedic also, and I started as a paramedic, and just being a paramedic for a little while kind of exposed me to a lot of the just kind of the shortcomings and kind of like the pitfalls of the healthcare system. So not only did I want to be able to kind of do more in terms of having a more increased like scope of practice and being able to do more in terms of taking care of patients, excuse me, but like also being able to play more of a active role in like policy making and kind of affecting change on a bit larger scale, which is a little bit more doable as a physician in some respects. That's really the primary motivation, I would say, because I mean, it just obviously having the increased depth of knowledge has been phenomenal. I mean, obviously, like I'm not done with school yet, but just this to this point, like things that I've learned have been mind blowing. So yeah, it's I don't know, it's kind of across board, and just that, just I don't know, I've always kind of had like a desire to know more than I know currently. So just being able to continually just build upon knowledge constantly has been really, really awesome.
Yeah.
Great. Well, I'm gonna have to go because I have to go to the store.
Okay.
Bye, guys.
Bye.
How do I leave? Oh, there.
We all do that. Nobody knows how to leave this thing.
We do this every week and we still don't know.
Every week, and yep.
It's interesting.
Uh-oh.
One of the things
Well, I
we
hope you
looked
guys
at
all have a
was-
good rest of the night. I'm gonna jet out of here. So
Well, thank you,
Yeah, thanks for
Been a pleasure.
joining.
Thank you guys so much. I appreciate it.
and it was nice meeting you.
Yeah.
Yeah, you guys too, definitely.
Have a great one.
Yeah, you
Have a
too.
good night.
All right, Kelsey, time for the secrets.
Be careful. Be careful.
Oh shit!
All right.
That's
Bye.
terrible. Bye.
You can figure out how to leave.